Hi, my name is Andrew and I'm going to give a short demonstration on auscultation. So first things first, auscultation is basically, we're going to focus on auscultating of the lungs today. So auscultation is basically listening to the lung sounds entering and exiting the lungs. So we do this basically in a respiratory assessment, so we can identify disorders of the respiratory system. Just an example that can relate to physiotherapy intervention would be retained secretions in the lungs. Usually after surgery we auscultate in a general respiratory ward, and also in ICU it is very important to auscultate. So before we auscultate, I'm just going to introduce it. So first of all, this is the device that we use to auscultate, which is called a stethoscope. You can also auscultate different areas, but we're going to focus on the lungs today. So we use the diaphragm part, which is the flat part, to auscultate, and also we make sure that the earbuds are pointing a little bit forward, so there's a better transmission of sound into the ears. Okay, so before that I just want to go through the anatomy of the lungs, because it's important to know the anatomy of the lungs before you auscultate. First and foremost, we need to know that the lungs are three-dimensional, so on the anterior side and the posterior side we have to auscultate. The right side of the lung has three different lobes. Okay, so there's an upper, a middle and a lower, and on the left side we have an upper and a lower. On the anterior side, usually most of the anterior side is the upper or middle lobes, and the back is mostly the lower lobes. Okay, just some reference points before you auscultate. On the anterior side, I'm just going to show them on this model quickly. We do above the clavicle, the mid-clavicular line, which is the apex of the lung. We go down to the second intercostal space, the third intercostal space, the fourth intercostal space. Then we move down to the sixth intercostal space, which is more lateral, and lastly at the mid line of the armpits. And then we're going to move posteriorly. I can't show you on this model because I'll show you just on my model. So I'm going to demonstrate now the auscultation process. Usually just a few tips to start off with. So we do it on skin, because if you do it on clothes it can rustle, which gives an abnormal sound, because basically what we're doing is we're listening for normal and abnormal sounds when we auscultate. With females, we just ask them to lift up their breast just to auscultate underneath. I already mentioned with the earbuds, and yes, so we're going to go and demonstrate. So a little bit forward. And also just to mention that when we do one reference point, we continue and do the opposite side, and just instruct the patient to breathe in and out with an open mouth. So each auscultation we listen to one exhalation and one inhalation. Okay. So Hannah, can you please just breathe in through your mouth and out through your mouth with an open mouth? Okay. Mm-hmm. So I'm going to do the apex and the other side. Good. And just second intercostal vertebrae. Okay. And the third. And the fourth. Okay. So all I'm hearing is just normal sounds. On the website we're going to differentiate abnormal and normal. Okay, we're going to go on to the next one. And last one. Okay, so we're just going to ask our patient to move around so I can show the posterior auscultation. Okay, so to eliminate the scapula being in the way, we're going to ask the patient just to put her hands on her knees. Okay, and just a little bit forward. Yeah, there we go. So we're going to start again with the apex on both sides. Then we're going to move down to T1. And then we're going to auscultate in between the midline of the scapula and the spine. And then we're going to move down to the lower part of the scapula and then to the side. Okay? So again, I'm just going to quickly show you. So Hannah, can you breathe in and out? Mm-hmm. Yeah. Okay, so that's my short demonstration on auscultation. Please see the website for further information. Thank you.